We got a 9. Ooh. Sharp things where they don't belong, electrical energy gone wrong, and what the heck is a cut-o-matic? Today, we're stepping into the neon-lit streets of Cyberpunk 2077,
Cyberpunk.
breaking down and reacting to the craziest injuries that this game throws at us. Let's dive right in. Whoa! What the heck? Injury to the back of the head via a sword. You know, we don't see those very often come into the emergency department, but we do see a lot of knife injuries, hatchet, hammers. Very rarely do we see the blades get stuck. A lot of times we'll end up seeing them bounce off. Blunt objects could cause more of an exploded tissue.
Explodes!
Which will cause a laceration and the concern for a fracture of the skull. Whoa. Whoa. Whoa, whoa, whoa. Impaled sword, what appears to be subxiphoid, or what we call the epigastric area. Looks like into the abdomen area. What's over there? Stomach, pancreas, transverse colon, and you worry about the spinal cord in the back, as well as the inferior vena cava. Potentially, more likely it's already diverted into the liver at this point, as well as the abdominal aorta. Oy. Oh. Oh, local electrocution can cause nerve injuries, nerve impairment. Greater, like stronger, more intense energy could then lead to cardiac arrhythmias. Typically, we see VFib, VTAC. You can go into asystole. If you're in VFib or VTAC, we're going to use electrical energy if you don't have a pulse. If you do have a pulse, depending on stability or not, sometimes we do still need to do emergent synchronized cardioversion versus are you going to use some chemicals, aka medications. Oi! Oh! Oh, what is that? It's like a chainsaw? It sounds like a chainsaw, and it says cut-o-matic. We're getting cuts on either side of the neck. If it's deep enough, you worry about your jugular vein, your carotid arteries. The jugular vein is the huge vein. It looks almost like the size of a quarter in diameter on an ultrasound machine. The carotid artery looks like the size of a dime. Oh, a crowbar. Crowbar and using the sharper end. I don't know if anybody has actually held a crowbar before. They're pretty heavy and solid metal. Fractures are your number one thing that you see. Besides having the tissue kind of break open, if it's blunt enough, it can cause it to lacerate open. But you can also see significant amount of bruising, and people can lose a lot of blood with a lot of bruising just depending on where it is in the body. And then this could actually be impaled in an individual as well. We're seeing that her facial enhancement is definitely malfunctioning a little. It's a little glitchy, which is pretty cool to see that they've incorporated that in. This isn't that far-fetched. Nowadays, we actually see people get these little chips implanted into their chest wall, and it helps cardiologists monitor their level of congestive heart failure, their ejection fracture, those sorts of things. Oh, wow. We're seeing a left upper thigh injury. The major vessels actually run into the groin.
My groin!
And then dive deep medially, so inside, and then go behind the femur. On the lateral aspect, you're just getting branches off. Less likely that you're going to bleed out on the lateral aspect. There's big muscles there. They're highly vascularized. Again, still could have a lot of damage. Somebody comes to the emergency department with a chainsaw injury. You're missing a lot of tissue. It's going to take a lot to repair it. Now, if it amputates the whole leg off, that's a different story. Remember, if you have an amputation of an extremity, you want bleeding control. Best way to probably bleeding control at that point is a tourniquet. You guys know how to do one. Awesome. If you don't, Jen and I actually made a video about putting on a tourniquet, so check that out on the channel. You know, it's an important, simple skill that everybody should know how to do. Oh, explosive injury has multiple different levels of how it could actually injure you. Explosive component, compressive force, rupture your eardrums, pop a lung. The other components are the shrapnel, debris that goes flying that can impale somebody, the fire, that type of explosive damage as well, burns, and if you're too close, the amount of force could be so much that it gets you. Oh, I'm assuming that is a chokehold. You have two different ways that somebody could maybe get knocked out. You're compressing down the trachea. The trachea has cartilage, but the rings don't go all the way around. They go maybe 3/4 of the way around, so you can compress down, or you're decreasing blood flow to the brain in and out. A lot of times it's a combination of the two, and you can actually cause severe damage and actually take someone's life. What? Whoa. Whoa, whoa. Ay, feel like an ear just got chopped off. What would you do if somebody sliced off somebody else's ear? Well, bring the ear to the hospital with the patient, put compression on the area to get the bleeding to stop, and hopefully you're at a facility that has a plastic surgeon that could potentially replant the ear. Sometimes you can't.
You can't.
But they do have the ability to have prosthesis to your ears in the future.
Well, you're right.
Whoa, 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 whoa. I wouldn't stand there, guys pulling out again. Oh, nice. Blocked right in the chest and cause them to succumb to their injury, either right to the heart or right to the lung, causing a hemopneumothorax that's not treatable in this situation. If you came to my hospital or the trauma centers around the US, we would end up doing a thoracostomy tube, putting a tube in the chest, get the air out, get the fluid out, get the lung to reinflate. Hopefully it fixes itself. Oh. Oh, whoa, we got a new move. Taking the neck in such a extreme range of motion is what causes the issues. You're ripping vertebral arteries, which run in the sides of the spine in the neck. You're ripping the bones and the connective tissue, that's the noise that you're hearing, and then you're destroying the spinal cord. High up has to do with autonomic nervous system, function of the heart and the lungs relating to just breathing. But whoa, that was crazy. What just happened? What just happened? What just happened? We're seeing anatomy a little bit. You're actually seeing like white, stringy looking things. This is most likely either depictions of nerves or tendons, most likely nerves, really interesting. And in the middle, you're seeing, could be the spinal cord, but it's hard to get everything that you really want to see in there because you have the spinal cord in the back surrounded by the bone, but you're still gonna have your airway and your esophagus in front of it, but they don't typically show it. They just show that as meaty tissue. We got a knife. Oh, I just see the head gone. Could be a puncture wound, high up, suboccipital, so below the occipital lobe in the back, can pierce right into the spinal cord high up, autonomic nervous system. Oh, that's a high jump. Wow. The jump onto somebody, breaking your fall, so to speak, but again, you can have significant injury as well. Facial trauma into hard surface can cause fractures, could cause intracranial bleeding, could cause whiplash injury relating to cervical spine trauma. We do see this often enough in the hospital where somebody has a mechanical fall or a syncopal episode where they pass out. They fall and they smack their head. Usually it's skin bust opening, bleeding, plus or minus skull fracture, plus or minus intracranial bleeding. Whoa, whoa. That one was different. When we see somebody who has a massive amount of skin gone, it actually makes for repair really hard. Like where you're gonna harvest the skin from, you can't just undermine a little bit the tissue around it to pull it in. It's not enough tissue. So a lot of times that instance, you'll actually need a skin graft, and that's when you need a plastic surgeon to be able to help figure that out. Intense extra weapons. Oh, whoa! Impaled injury to the lower abdomen, almost into the pelvis. See, that's almost coming out where the sacrum is or your lumbar spine is. You can actually miss major vessels because the aorta comes down and then branches off into like a wishbone scenario to go down each leg. So it actually might go through that. But you got the bladder, you got your rectum, you got intestines and omentum. So a lot of other structures there that won't necessarily immediately kill you. Fire, things I worry about, burning skin, flesh falling off, pain, and then airway issues because the fire can take away the oxygen around you, as well as inhaling the fumes and the smoke. When somebody comes to the ER, we'll examine to see if there's singed hairs around the nose, soot in the nose or the mouth, to see if there's anything in the posterior pharynx. We get concerned that there could be airway compromise in those situations. Ooh. All of a sudden, we don't need to worry about that. We have an injury to the submental area, so underneath your jaw, up into the face. It could actually just be a flesh wound, versus if it goes far enough, you can go into the brain tissue, into the eye socket, and then you can also go backwards deeper into the airway. Watching all of these chaotic encounters is enough to make anybody stressed out. If you're feeling like you need a reset after all of this, definitely check out Chillax to help you stay calm. No implants required. Grab yours at lifehappens.com or on Amazon and get your chill back before the next glitch. This whole scene is just filled with a lot of skulls getting separated and massive traumas. Could this occur from a blade like this? Probably not. You need a very sharp blade or a massive amount of force to make these things happen. These type of injuries do not come to the emergency department because they're not compatible with life, so they would not be brought through the emergency system. They would be pronounced on scene. Hand-to-hand combat. Whoa, hand-to-hand combat, but you're getting shot. Hopefully you're wearing protective gear, but not everything is 100% bulletproof. It does have weakened spots and it can get destroyed. Injury to the face, you can stun somebody, you can get dizzy, you can get lightheaded, you could actually pass out. Enough force to somebody's head, or even blunt, can actually shift your brain in and out of the skull, causing a counter coup injury where you can have bruising to the brain, or you can rip the bridging veins and cause a subdural hemorrhage. He's wearing one of those N99s, or the masks that we almost used back during the pandemic. We use N95s, but in different industries, they actually use higher numbers. It has to do with like particle size. It's getting impaled in the abdomen, and actually quite interesting, trying to grab it with his hands. It's not instinct to do that per se, because you're gonna cut your hands and it hurts, but it actually might be a benefit. Oh, wow, that is that blade reminds me of Rambo's.
They drew first blood, not me.
Stab to the left side of the chest, could go into the lung or right into the heart, but you're breaking through the ribs as well, which is quite painful. You're going to cover the wound, put packing on it. Person's going to have difficulty breathing, most likely if it's related to the lung. Could be a hemothorax or a pneumothorax, both treated very similar with a thoracostomy tube. Remind me never to move to Night City, California. I'm good where I'm at now. I don't need to go to this town. Also, check out my limited edition Dr. ER apparel, available now for a short time only. Once it's gone, it's gone. So grab yours before it's too late at shopdrer.com. If you guys enjoyed this, definitely check out this playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.